Good morning. Yesterday at the press conference, I mentioned that I'd be announcing decisions related to the May 15th expiration of some mitigation restrictions in the Disaster Emergency Proclamation. I'm still reviewing some information with the Department of Public Health and my team today, and will be announcing the new changes tomorrow. I know that Iowans and businesses are eager to know what's next, but as I've said all along, these decisions must be made carefully and driven by data, and I look forward to providing that update tomorrow. If you're following Iowa's numbers on the COVID-19 dashboard, you'll have noticed an uptick in positive cases reported today. I want to provide an important clarifying point about this total. Of today's 539 new positive cases reported, 319 were among Iowans who were tested in Nebraska between April 28th and 30th, tied to a processing plant. They were notified of the results shortly after being tested, but the reporting back to the state of Iowa was delayed. But we do have, so those are included in today's case counts. If there is one thing that COVID-19 has shown us, it's the little things that we likely took for granted that made our life seem normal, like taking the family out for dinner, having the grandkids over for a sleepover, or just seeing them off to school, going to church on Sunday, or being able to head to work in the morning. And while so much has changed in a short period of time, it's hard to believe it's just been 2 months, working together, Iowans will get life back to normal. One of the greatest scientists, Marie Curie, once said, and I quote, "Nothing in life is to be feared. It's only to be understood. Now is the time to understand more so we may fear less." Our goal from the beginning has been to protect the health of Iowans, flatten the curve, do everything we could through our mitigation efforts to manage our healthcare resources so that we didn't overwhelm our healthcare systems. And we've done that. Today, we have 699 vents available and 451 ICU beds. Surge plans are in place, and our healthcare systems are ready. Because of meeting that, we're able to safely and responsibly open our state. Testing is happening across all of Iowa. In fact, since March, we've increased our testing and processing capacity at the State Hygienic Lab over 800%. We've gone from 300 a day, processing 300 a day, to 1,300 a day, to 3,800 a day. We've deployed strike teams to conduct surveillance testing in communities where virus activity is increasing. And by the end of the week, we'll have opened 8 test sites. The newest will open Saturday in Storm Lake. From the State Hygienic Lab to Test Iowa to individual hospitals and clinics to our long-term care, manufacturing, and community Iowa test sites, and soon-to-be point-of-care testing, our state has mobilized with multiple partners and options to significantly expand testing, scale case investigation, all which enables us to track virus activity across the state and deploy targeted strategies to contain and manage it. For now, we must learn to adjust life and business accordingly so that we can live, work, and play the way that we want, while continuing to prioritize the health of Iowans and to get our economy back on track. 2 weeks ago, I announced that Iowa would begin to loosen some restrictions in 77 counties where virus activity was sporadic, low, or non-existent. On May 1st, restaurants, fitness centers, and retail stores were allowed to reopen in those counties. At 50% of their normal operating capacity, and according to specific requirements from the Department of Public Health designed to, again, mitigate the spread of the virus. And what we've seen since the May 1st changes became effective, is a very cautious approach from both businesses and churches as they carefully considered how best to reopen. Many are taking extra time to ensure that they are ready to safely serve their customers and communities, and I respect those decisions. Lifting restrictions is not a mandate that businesses must reopen, but for those that are ready, it's an opportunity to get back to business, bring employees back to work, and get Iowa's economy moving ahead. We're taking a phased approach that allows us to start small, to learn how to adapt operations according to public health guidance, and to build our consumer confidence. Each business will determine what's right for them. Today, I've invited Ellen Walsh Rosman, owner of Farm Table and Milk and Honey, a restaurant in Harlan, and a recipe of small business relief, and a recipient, Ellen, of the Small Business Relief Grant from the state to share her story about how COVID changed how she does business, what she's learned from the process, and how she plans to come back. So, hi, Ellen, it's good to see you, and we'll turn it over to you.
Hello, Governor Reynolds. It's good to see you as well. Thank you for inviting me to speak today. I wear many hats in the food system. The first hat I wear is I'm a farmer, and I also own a farm-to-table restaurant in Harlan, and I own and manage one of the largest remaining food hubs in the state. So I'm definitely seeing the impacts of COVID on the food systems from all sorts of different angles. Just a little bit about our business. So our food hub, farm table procurement and delivery, we work with about 40 different growers across the state of Iowa and distribute and market and aggregate their goods to restaurants, grocery stores, food service institutions like schools. And now more than ever, food hubs and local food seems to be relevant and be at the center stage. And we're responding to that. We've had to increase our staff to respond to this demand, which the Small Business Recovery Grant helped us do. And then we've also pivoted our business pretty quickly. Now, local food helps really get the food to folks direct from the farmer, so we're not having to deal through many distribution channels. We have seen how essential food service and how small business owners, restaurants, and farmers are pivoting, like I said, and getting food safely to their customers. People are innovative, and other business owners and organizations like myself have pivoted their business models overnight, offering curbside pickups, drive-through farmers markets, like our partners at the Iowa Food Hub, Field to Family, North Iowa Fresh, Prudent Produce, and the Iowa Food Co-op. They're all doing these things to respond to consumer demand. The Small Business Development Grant, Recovery Grant, will help us with the day-to-day operations, like I mentioned, and increase the additional staff that we've had to respond appropriately. We can also continue to pay our local farmers that we work with and make sure we're paying them quicker to help them with their livelihoods. And I also own a restaurant, like I mentioned, called Milk and Honey on the square, and we have a very small staff, about 6 employees, and we were able to pivot. It was very scary at first when we closed because we didn't know what the future would look like. We still don't have a clear picture on what that would look like, but we pivoted pretty quickly, offering online ordering, contactless payments. Our sales are significantly down, which the Small Business Recovery Grant is helping make up for. And our employees have had to make big sacrifices for their families. But getting this grant will help us pivot and alleviate some of the risks that we're taking to keep our doors open and keep serving the public and doing it safely. So we haven't completely opened our restaurant because we have a very small restaurant. We seat about 49 people. So we just couldn't find a way to make that work. And we have a very small staff, like I mentioned, of 6 people. And we don't really want any of them to get sick, else we'll have to completely shut down the restaurant. Like I said, I'm very grateful for all the support that the governor and the IEDA has given to small businesses during this time, because we do make up a large portion of the revenue for our state. Mm-hmm. And a lot of businesses aren't, unfortunately, going to probably be making it through this if they weren't able to pivot and without a grant to help them alleviate that risk. I do want to say that the reality, though, is we still need to continue to support small businesses. They are still struggling. It's not over. So there's many things that we can do to make that happen. So public support, like the state of Iowa has given to small businesses at this time needs to continue. Consumers need to continue spending their money locally and also supporting small farms. So look for other food hubs across the state and farmers markets. There's a lot of drive-through farmers markets that are happening. People are being very innovative in how to get food to folks. And we also need systematic change. This change can be by voting 3 times with your fork, 3 times a day with your fork. And you can dictate what kind of food system you want to have. I just want to thank you again for the grants. It really, when I got word that we got it, it really gave us hope and felt like somebody believed in us. And it really validated all the sweat equity that we have put into our business in the last 6 years, as well as all the sweat equity that we're putting into our business now. And I know I'm not the only one that feels this way, but we really do appreciate it. Thank you.
Thank you, Ellen. And I have so enjoyed watching you with your business. You are tenacious, innovative, and determined. And so I'm not surprised at how you've really adapted and moved through this really difficult time with COVID-19. So thanks for sharing your story today. There's so many small business owners across Iowa that are getting ready to take these first steps. I love the drive-through farmers market. That's very innovative and cool too, and just what you're doing to really continue to work with the farmers to get their products to market. So thank you for that. I wish you the best of luck, and I look forward to getting back together with you the next time I'm down in Harlan. So keep up the good work, and we'll continue to reach out and make sure that we're partnering together with small businesses across the state as we move through this really difficult time. But thanks for sharing your story today.
Thanks.
Bye-bye. So getting life and businesses back to normal is important for many reasons, not at least of which is ensuring the well-being of Iowans. It's important that we don't lose sight of the unintended consequences that our response to COVID-19 has had. Iowans have filed more than 206,000 unemployment claims and more than 147,000 federal pandemic unemployment claims. According to the American Farm Bureau Federation, Chapter 12 family farm bankruptcies for the 12-month period ending in March totaled 627 filings nationally. That's a 23% increase from the previous 12 months. 37 of those bankruptcies were Iowa farm families. The steps that we've taken to protect the health of our state and Iowans has had a real impact on Iowans and families. Iowans like Dave Ferris. Dave is the owner of Sneaky's Chicken in Sioux City, at the landmark restaurant he started with his brother in May of 1979. Under normal circumstances, they would be making plans to celebrate their 41st anniversary next week. Instead, they are seriously evaluating their ability to continue to keep their doors open. Mr. Ferris stated, "While I'll always support public health first and foremost, the COVID-19 pandemic has been devastating for our business. Before the pandemic, I was making plans to transition my life's work to my daughter. Now the likelihood of being able to pass on our family legacy is looking grimmer and grimmer every day. We're closed for our dining and catering operations." It's stories like Dave's are a reality in communities across our state. There are Iowans who are struggling. Being out of work has a tremendous impact on Iowa families. Due to increased unemployment, applications for food and cash assistance have also increased, and families have lost their health insurance where they've been laid off from their jobs. For those who already struggle with mental illness and addiction, these events can trigger increased anxiety and depression or result in a relapse. Just as we are doing our part to protect ourselves and others from the virus, we also must protect the mental health and well-being of all Iowans. Today, I've asked Director Flynn from Homeland Security to provide an update on the crisis counseling funding Iowa recently received. Joyce.
Thank you, Governor. I'm pleased to share that today the required application to the Federal Emergency Management Agency's regional office in Kansas City for approval of the Crisis Counseling Assistance and Training Program will be submitted. The Governor's request for activation of the Crisis Counseling Program was approved April 30th. Like many disaster recovery programs, funding is awarded through the Iowa Department of Homeland and Security and Emergency Management. For this program, Director Kelly Garcia and her team at the Department of Human Services developed the application for review and will contract with 5 providers from across the state to deliver the services. Program services are provided at no cost to Iowans. Based on the specifics of this event, DHS has developed a plan for statewide virtual outreach of services with a focus on special populations. Special populations include agriculture and rural issues, children and families, workforce, whether unemployed, essential or non-essential, older adults, persons with developmental disabilities, domestic violence, homelessness, and military families and veterans. The Crisis Counseling Assistance and Training Program consists of services focused on preventing or mitigating the adverse repercussions of a disaster. The program goal is achieved with a public health approach. Beginning with the most severely affected groups and moving outward, the program seeks to serve a large portion of the population affected by the disaster. The virtual program counseling services will be provided statewide and will include supportive virtual counseling, psychoeducation, development of coping skills, and linkage to appropriate resources while assessing and referring families of the community to services in their community. They may need intensive mental health and substance use treatment services, and they will be linked to those appropriate community resources. Iowa's application requests approval of both an immediate services program and a regular services program. The immediate services program provides funding not to exceed 60 days from the date of the declaration, and the regular services program, if approved, will continue those services for a period not to exceed 9 months. With program approval, Iowans will have ready access to a variety of mental health services designed to lessen the impact of the COVID pandemic. In closing, I want to thank the folks at my department, Homeland Security Emergency Management Team, state and federal partners, and all local emergency management coordinators who are responding to this event and continuing recovery from disaster events that have impacted the state in the recent years. Thank you, Governor.
Thank you, Joyce, and I want to thank you and your team for doing so much to serve Iowans at this time. Your work is critical to our response, and I'm extremely grateful. Before we close, I've also asked Sarah Reister to provide a brief update regarding our plan to use remdesivir for COVID-19 patients. Sarah?
Thank you, Governor, and good morning. As we respond to the COVID-19 pandemic, we are all working to identify new tools to combat the spread and the severity of the disease. As many of you may know, the U.S. Food and Drug Administration, or FDA, has issued an emergency use authorization for the investigational antiviral drug remdesivir for the treatment of COVID-19. This authorization allows the medicine to now be distributed in the United States. It was previously only able to be used in clinical trials and for other investigational research. The medicine can be used for both adults and children hospitalized with severe COVID-19 illness. It has been shown in clinical trials to shorten recovery time for some patients. At this time, Iowa has received 400 vials of remdesivir. Patients will require either 6 or 11 vials for treatment, depending on their needs. The distribution to Iowa is part of the U.S. Department of Health and Human Services' latest effort to provide 14,400 vials of the medicine to state health departments. The 400 vials provided to Iowa will be distributed by the State Hygienic Laboratory according to the number of hospitalized patients in an area, the number of patients in an intensive care unit in an area, the trends in those numbers over the last month, the trends in disease activity, including new cases over the past 2 weeks, and the available resources, including equipment and personnel needed to appropriately manage these patients and this medication and their potential side effects. We are consulting with infectious disease clinicians, pharmacists, and hospitals across the state in establishing these criteria as we work to quickly distribute the medicine. We will continue to share lessons learned and insights as we move forward with managing this medication and any additional resources we might receive in Iowa. Healthcare providers and patients receiving the information or the medication will get detailed fact sheets from the FDA about the medicine so they know how to administer it and what to expect. The drug must be administered intravenously by healthcare providers to hospitalized patients with severe disease. Severe disease is defined as patients with low blood oxygen levels or those who need oxygen therapy or more intensive breathing support, such as a mechanical ventilator. The emergency use authorization was issued to Gilead Sciences, which had been doing work with investigational medicine and who has agreed to provide it at no cost for distribution to state health departments. In determining whether to issue the emergency use authorization, the FDA indicated it evaluated the available evidence and that it carefully balanced any known or potential risks with the potential benefits of making this medication available to patients during the pandemic. We are hopeful that remdesivir will be another helpful tool in managing the severity of COVID-19 for our most severely ill patients, and we look forward to more medical and public health developments as we continue to respond to this global pandemic. Thank you, Governor.
Thank you, Sarah. So finally, in closing today, before the end of Nurses Week, I want to thank Iowa's nurses who are at the heart and soul of healthcare. Whether you work in our hospitals, clinics, in your patient's home, in long-term care facilities, or in our state agencies, what you do is incredibly important, especially during these unprecedented times. So again, just a heartfelt thank you to all of our nurses who are on the front lines each and every day, and especially during this difficult time. Thanks for everything that you do, and thank you for being there now for the Iowans who need you most. So with that, we will open it up for questions.
Chris, KCCI, go ahead.
Hi, Governor. So what specifically is holding you back from easing the restrictions today or announcing those restrictions? Is there a set of information you hope to get in the next 24 hours will help you make that determination?
No, well, they don't really expire until the 15th, so we had some time. So I want to continue to look at the data and work with the Department of Public Health and our team. We're seeing some positive trends. We're seeing downward trends. We're seeing our hospitalization rates stabilize. And as we begin to continue to reopen the state of Iowa, we're really going to be basing it on our ability to manage our resources and not overwhelm our healthcare systems. And because of Iowans' response and what we've been able to put together with unprecedented collaborations between our healthcare systems, we are in really good shape. But as we implement the testing sites across the state and we continue to look at the trends, I made the decision to just wait one more day before I move forward with making the decision. So we'll do that tomorrow, and we'll continue like we do every day. I mean, when I say we are looking at the data on a daily, weekly, we're looking at it from a 3-day, a daily, a 3-day, a 14-day rolling average. We're looking at different areas of the state. We're gathering the data that we see when we go in and do some significant testing at some of our facilities, the spike that we see that we anticipated happening, and then the time that it takes for them to recover and what that looks like, 7 to 14 days out. So we've got some pretty significant data that we've been able to collect from the eastern side of the state as we start to see the virus moving west. So that'll be very helpful and informative as we target our response and do our testing in central Iowa moving west as we see the virus continue to work from the eastern side of the coast more towards the Midwest and continue moving west. So that's what we'll continue to look at. They don't expire until Friday, so we'll make those decisions. We'll make that announcement tomorrow.
Aaron Murphy, Lee News.
Thank you, Governor. Your order, and correct me if I'm wrong on this, but your order says schools can start earlier than the August 23rd date, only if doing so extends next year's calendar beyond the normal 180 days or 1,080 hours. Given that, do you plan to ask the legislature to provide additional funding for schools that wish to do so, or are districts going to have to come up with funding on their own to operate longer than what they would have budgeted for a normal school calendar?
Yeah, and I think actually the Department of Education, working with our school districts across the state, are looking at some things that they might be able to utilize by transferring some of the contract days for this fiscal year over to next fiscal year, using those in a limited amount. So they're reviewing ways that we can implement that. The reason that I waived the start date was, to try to start to do some remediation efforts so that we could get our kids, kind of get them in, start doing some testing, evaluate where they're at, and maybe what we need to do to remediate to make sure that they're ready and to learn and continue to grow. So as we move through opening up the state of Iowa, we'll also see as we get a little further down if there's an opportunity for us to open up summer school and some summer activities as well. So those are some of the other things that we're looking at that could potentially be an option for schools across the state to start some of that remediation process as well. But I would encourage them to talk to the Department of Education. They're working extensively with the school districts across the state. They've got a task force that they put in place to really, evaluate the questions that some of the school districts have so that they can provide some solutions and suggestions as we move back into the next school year. And most importantly, making sure, that our kids are where they need to be and so they can continue to be successful and learn and be ready to, move to the next grade and to continue to be successful.
Kay Henderson, Radio Iowa.
Governor, I believe you said a few weeks ago there were 18 food production plants in Iowa, and after the tests at Columbus Junction, Tama, Waterloo, Sioux City, Denison, Perry, and now Storm Lake this weekend, how are you going to prioritize the test Iowa schedule for the rest of the facilities?
So we're doing that on a continuing basis, and as we've been able to ramp up, and once we get the Test Iowa validated, which I believe will be done today, then we'll be able to continue to work through them. We're doing it in a whole host of ways, sometimes even with the processing plants and with the long-term care facilities. Sometimes we can send the test equipment there. They have the nurse practitioner that's able to implement the test at the site. Sometimes we're doing it at a community test site, or a combination of both. So as we validate Test Iowa and we continue to move across the state, I think they showed the map, hopefully up on the screen. It'll give Iowans a very good indication of how we are actually moving through the process. We have a plan in place, and we've got a great logistics team that once we get a site established, they're looking at the next two sites, where we can do the testing, what makes the most sense for the facility, and how we can move forward with that. So we're looking at that too on a daily, weekly, 2-week basis as well.
Next question, Amy, Waterloo Courier.
Yes, thank you, Governor. We know that the virus is moving into long-term care facilities via employees and staff who, of course, aren't restricted and they're free to move about. And IDPH has told us that the virus is especially deadly among those populations. Is your office considering that as it considers, reopening parts of the state or certain businesses?
Well, our long-term care facilities have basically been locked down since the middle of March. Since we first found out about the virus, we actually had met with long-term care facilities and associations to really talk about how we could be proactive, because we understood with 444 long-term care facilities in the state of Iowa, and this is our most vulnerable population, just like it is when we're dealing with extensive flu in the state and the impact that that has on our long-term care facilities, or if we have other infectious diseases that would impact our most vulnerable. We came together and talked about what we needed to do to be proactive, and that meant restricting visitors, then shutting down visitors, testing employees before they came into the facility, making sure that they had adequate PPE in order to take care of the long-term care residents. But do you have anything to add to that we've done, in conjunction with that?
No, I would just reinforce what the governor said, just in terms of making testing supplies and facilitating testing for long-term care facility employees. And so The governor and her administration and the Department of Public Health have just been working really closely with those facilities to make sure that they have access to testing that they need so that they can identify and exclude anybody who might be ill from the workforce to prevent the spread of the virus within those facilities.
Yeah, that's a really good point, Sarah. I think I said yesterday we've tested 115 facilities already, and that number continues to increase. And it's sometimes it's a partnership like we did in Dubuque, where it was your local public health working with the community to provide the testing through LabCorp, or whether it's a community test, Iowa test site like we did down in Louisa and Muscatine and Tama, where we could actually pull staff from several long-term care facilities to get them tested so we could start to understand what the scope of the outbreak was, and so we could get in front of it to really minimize our impact on the residents in the long-term care facilities. So we continue to call through on a daily basis to nursing homes across the state to make sure that they're aware of the testing that we have available, encouraging them to do that, and really, working with them to eliminate any barriers that they might have in providing the testing both for the residents and for the staff as well, so we can again get in front of really spreading the virus in the homes.
All right, we're going to go with two more questions. Ryan, Associated Press.
Yes, thanks. What caused the 2-week delay in reporting those 300 cases from the Tyson plant in Nebraska? And does the state of Iowa now consider what happened there an outbreak?
I don't know if we can.
Yeah, thanks, Ryan. The information that the governor talked about earlier, say these were test results that were in the custody of the state of Nebraska, and so I can't speak to their processes and the reason for the delay in transferring that information to the state of Iowa. So we're grateful that we have it at this particular point in time. As the governor mentioned, we do believe that the employees did receive their test result, but this will allow Iowa staff in the local public health agency to start doing that contact tracing and case investigation, so we can help to identify any close contacts those individuals may have had and try to give them appropriate public health guidance. In terms of whether it meets the standard of an outbreak at this particular point in time, haven't had an opportunity to analyze the total number of employees in that facility, but that is also a facility that is not located in the state of Iowa.
Sarah.
Last question, Perry Beeman.
Thank you, Governor. As you look to reopen more facilities, will you also at the same time be looking at reinstating the various state regulations that were suspended earlier?
Yeah, that probably won't be a priority. We'll probably continue with most of those at least until the end of the month, but our legal team, working in conjunction with the Department of Public Health and our various agencies, continue to review some of the regulatory relief that we've put in place. So right now, we're going to continue to look at some of the businesses and kind of getting the businesses that were closed or suspended to try to figure out a way that we can go ahead and get them reopened by doing it in a safe and responsible manner, really having them abide by some of the protocols that we put in place so that we can slowly start to open them up. And again, they've done a remarkable job. I'm really proud of the responsible way in which our businesses are implementing as they prepare to open back up to take care of their customers. So I'm proud of Iowans for the response that they have really taken to COVID-19, and especially to those businesses and churches and just organizations across the state as we start to and continue to open up Iowa. Thanks for being responsible, and we will together really, I think, we'll be able to manage the health and well-being of Iowans as well as their livelihood and the state of our economy as well. Thank you.